Hello everyone, my name is Gabriela Esquivel and today we're going to be doing a decontamination of surgical instruments. And in order for us to be in the decontamination area, we need to be wearing proper PPE, which in this case includes my scrubs underneath, we have an apron, we have gloves, we have glasses, and our protective mask with the head protection, hair protection. And what we're going to be doing today is we're going to be doing a demonstration with 4 of the surgical instruments. For the first one, we have a Yankauer suction tip. The second one is the curved Mayo scissors. The third one, we have a non-penetrating towel clamp. And the fourth one is the DeBakey forceps. So these ones clearly have soil. They're soiled. They came from the OR, and they were not properly cleaned. They did not properly go through the first 3 steps of the cleaning steps. So in order for us to continue, we're going to be doing submersion of all of these instruments underneath the water, and the water should be at a temperature of 80 degrees to 110 degrees Fahrenheit. And this is to ensure proper breakdown of the debris or the instruments that are soiled. And when we're cleaning the instruments, we want to make sure that we clean and we use the proper solution for the type of cleaning that you're going to be doing. Either if you're going to be using detergent that breaks down proteins, which are the protease, or the ones that are going to break down fats, which are the lipase, or the ones that are going to break down starches, which are the amylase. So it's very important that when you're doing the cleaning steps and the cleaning process, you want to make sure that you keep the instruments underneath the water submerged, so that none of the debris splashes onto you or your PPE. You want to make sure that you keep them underneath the water. You want to be careful, gently clean all of the instruments. You want to make sure you open the instruments to make sure that you are able to reach the area which is the lockbox. And this area sometimes holds some debris and it's very hard to see. So you want to make sure you clean that. And for the Yankauer suction cup, we're going to be using a brush that can be pushed in through the lumen. So again, this is the 4th step of the 6 steps of the cleaning process. The first step is the point of use pre-cleaning. The second step is the initial inspection, where you remove any of the sharps or disposables or disassemble any of the instruments. The third one is pre-treatment, and they can either be pre-treated with cold water, suggested enzymatic solution per the manufacturer's IFU, and this ensures the breakdown of blood or organic material. And then for the brushes or sponges that you're going to be using, you can either, after you're done using a particular brush, you could either rewash it. If it's a rewashable, or if it's disposable, you dispose of it right away. In this case, I'm going to be using a brush that's going to go through the lumen to make sure and we break down any of the debris that is in the inside. You want to make sure that it goes all the way through the lumen. Okay, you push it through all the way out. Pull it out from the other end to ensure proper cleaning. And you dispose of this one right away. Okay, so once the instruments are washed, we're gonna set them and prepare them so that they can go into a mechanical wash, which is going to be part of the fourth step. So we want to make sure we rinse the instrument before we send it to the mechanical wash. Okay. This is also the fifth step, and this removes any leftover debris or residue from enzymatic detergent process. And there's different processes that can be used. For example, reverse osmosis can be used, and this ensures that any leftover debris is completely removed from the surgical instruments. And then the sixth step is the final step before high-level disinfection and sterilization. So you want to make sure you inspect the instruments and make sure they're ready to be fully sent to sterilization into the machine so that they could be properly sterilized and packaged. Okay. I think that's it. Thank you for watching.